Depression is a major public health problem with a prevalence rate of 3.9%, meaning 7 million Nigerians suffer from it. 1 in every 10 people is said to experience depression at one point or the other in Nigeria. Experts say people experience depression in various ways, which often interfere with work, relationships, and general productivity. Feeling sad once in a while is not out of the ordinary, but when it becomes a regular occurrence, that's a red flag. Let's kickstart the conversation. I am Siju Alabi. Depression is classified as a mood disorder that often hampers a sufferer's daily activity. To help us understand this is a dynamic psychiatrist and CEO of Empathy Space, Dr. Kafaya Ogunsola. Thanks for honoring our invitation.
Thank you for having me again in your studio.
So great having you join us again. As I said, it's a pleasure that you honored our invitation one more time. Today we want to talk about depression. Is depression a mental illness? Let's start from there.
All right. Yes, indeed it is. It's classified as a mood disorder, as you rightly said in your intro. And basically, when we're talking about the mood, we're talking about the sustained inner feeling tone of an individual. You know, the mood is very important because it colors a lot of things. It colors how you interact with the world. It colors your ability to think. So, for instance, imagine that one is in a normal, in an okay mood state. You're neither happy nor sad.
Nor sad.
You're able to do things. There's nothing bothering you. You're able to apply yourself. You're able to think clearly. You're able to execute, to direct, to interact with other people. You don't see the world as hostile, as an angry place. Now imagine somebody who is in a mood state that is depressed. And this depressed mood state is not just a fleeting thing. It becomes like a persistent thing, because for us to say it is depression, it has to be persistent. It has to be there for most times of the day, lasting 2 weeks or even more. And the funny thing is, the person who is depressed cannot give a reason to their depression. It is not because you have just lost a loved one. It's not because you lost your job. It's not because you're broke. It's not because you're having problems in your marriage or anything. You're just sad and you cannot bring yourself out of it. Your mood cannot react to positive stimuli or stimulus. That definitely will affect a lot of things, because energy begins to drop, interest in activities begin to be affected, appetite is affected, sexual libido is affected. So when you have the mood state that is depressed, the duration extends for more than 2 weeks and you cannot explain why that is happening to you. It's beginning to cause you distress, because now it's sad to be sad. You're wondering why am I sad, and you can't get yourself out of it.
Which brings me to my very next question. I mean, you've just said a sufferer, I don't know if that is correct to say, that someone experiencing this condition or living with depression couldn't say this is the reason why I'm feeling this way. Are you now saying to me that there are no causes? I mean, going by the fact that depression is very, very prevalent, particularly in Nigeria.
So
are there causes? Are there some factors?
There are factors, all right, and some of these factors might even date back to not even this person as an adult, but to childhood. So when we're looking at the causes of mental disorders, particularly depression, anxiety, we like to examine things retrospectively. So we're talking of things like predisposing factors. one of the things is genetic influences. So a family history of depression in the family of the person who is now manifesting symptoms of depression.
Oh my.
So those are the biological predisposing factors. We're also looking at psychological predisposing factors. The childhood, the psychological or traumatic experiences or exposures of this person, be it domestic violence, disharmony in the family, child abuse, child neglect. And so that's why we keep sounding the alarm bells, how children need to be paid attention to, because in truth we're able to trace these things to the childhood of the sufferer. That would then bring me now to the school environment. Also very important when we're looking at the psychological predisposing factors of an adult who became depressed in adulthood. We also look at precipitating factors. So that's the one that has a temporal relationship, and that's the one many people would always cling on to. Oh, it's because this person was jilted or left at the altar, that's why this person is clinically depressed. But there are already a lot of things that are already like cracks in the psyche of this person. We just need a major life event to then come and crack, or be the last straw on the camel's back, if you know what I mean.
Yes.
That's exactly how it works. And then you can now look at also ongoing circumstances of the person. So we call those the perpetuating factors. So maybe a bad marriage, financial challenges, things like that. So it is multifactorial. It is not just one thing that comes and then we say this is depression. We don't even want to fixate on the immediate life event. We want to look at other contributory factors that then brought this person to the place where they're clinically depressed.
Now, does our environment trigger the rising spate of depression, particularly in women? Our environment can be challenging, particularly for women. When you look at all the things women have to do to actually live.
Yeah, you're very right. So it's actually more prevalent in women. Not to say that it doesn't happen in men, but depression actually is more of a woman's disease.
Wow.
The same way suicide is commoner in men. So men are more likely to die by suicide, because I want them to know their own. It's always, people always look at depression and anxiety like, oh, it's just women that suffer. It is not true. We have a lot of men who are clinically depressed and are getting help. But yes, it's commoner in women. All right, and yes, the woman is more predisposed. We're more of emotional beings. We have more hormones coursing through us. We're the ones that will go through puberty with the sudden changes in our body that can be suddenly alarming. More likely to have weight problems. We're the ones that would have the cyclical problems, menstruation, have a child, postpartum depression, postpartum this and all of that, and then the struggle.
Raise the child.
Yes, and then exclusively breastfeed the child, and then school
combined
runs,
with work.
Yes, school runs, career, and then trying to maintain all these things. We refer to it as the woman in the middle, because we're in the middle of so many pools, so many things. You have to be somebody's mother, somebody's daughter-in-law, somebody's wife, somebody's mother, somebody's driver, somebody's nanny. So yes, women are, because there is so much. All right, and then the pressure to also excel at all these things. So you're looking at the next woman who seems to have everything put together, and you're like, why can't I get anything done for myself? So the comparison as well of other people who seemingly have it more put together. These are things that can begin to also affect a woman's psychology.
So how do we get out of this?
First things first, be in competition with yourself. All right, and I always say this to anyone who wants to listen. The focus is on you. This journey is yours alone. All right, all these other people are just side attractions and distractions. Focus on yourself. Set your own goals and make sure that you're smashing them. The moment you begin to compare yourself, then that's a problem. For the woman who is juggling so much, if you can afford it, please get help. All right, and for the woman who can afford to have help, look for other. You know how the community in the past used to relieve mothers of all these things. When your child is in a safe space, you can rest. These are networks that need to be rebuilt so that you can have your own me time. All right. And then another thing is for women to understand that these things are real. Okay. If you're beginning to sense that something is off, or you're struggling, please speak out before it becomes a huge thing and comes to clinical attention. From the onset, when you're going through something and you're able to share it with somebody, you know, it's like you having a bit of the pressure on your balloon being relieved by talking. Sharing is good, all right? So don't clam up. Do not keep all these things to yourself. Find somebody that you can speak to, somebody that would then give you informed
good advice because,
on how to
just
navigate.
Sharing information,
exactly.
You can go and share with the wrong person.
Oh, definitely.
Yes, because I mean, I was just going to say, are women beginning to open up to the idea of seeking help and not shoulder the burden by themselves?
I think that as we speak more and as you know, as platforms like this continue to reach people who need to, they will embrace it. I, from experience, from my own, you know, clinical experience, I can see that people are open to getting help for as long as they know that the space they're coming to is confidential, it's non-judgmental, and that they would get, you know, they'll get the listening ear that they require, and they know that they can get help there. So as more people become aware that although depression is a serious mental disorder, it is very treatable. You can get the right support, and it doesn't have to be the reason why you are not able to, you know, fulfill your potential or to get to the place that you want to get to.
Don't you think it's a fear of stigma that might, you know, kind of make some women withdraw, even identifying when there's a problem?
Yeah, I hear you. So the stigma is still pervasive. The stigma is still there. But I assure you that as we continue to speak about it, as we continue to demystify, of course, in the past, depression has been referred to as spiritual attacks. So as we continue to speak that it's a medical condition, just like it's a chronic medical condition, but now just affecting, you know, the brain. So it's a mental disorder, not a physical disorder, and that it is similar to disorders like hypertension and diabetes, which are physical disorders. As we continue to say that you can come to the hospital for treatment, not go to the mosque or to the church for deliverance and for ruqyah, people will then begin to also want to associate with it. And as more people, more celebrities, more influential people, big people share their own stories of living with the disorder, people would also become, you know, they will become more empowered. They will become less stigmatized to say, oh, this person shared the story about depression. Then why can't I also accept that I have this thing and get help for it?
The most recent being Prince Harry and Meghan, and you know, all of these people, even someone as influential as some of the singers, you know.
So when we have people like that share their own story, people that, you know, the population look up to, that the society admire, and they come out to say that, you know, even we have influential people, let me not mention their names, a lot of people.
We can talk about the foreign ones, you know, the safer.
You know,
but
you know, Nigerians.
One of the most successful actresses in the United States, Taraji Henson, happens to be living with depression.
Of the cookie lion of the lion dynasty. Yes. You know, so when people like that share the story, then people would also be able to relate.
And that's the problem we have in our environment. We don't like to share experiences or situations affecting us because of stigma, fear of stigma, and or they will label me as mad or something like that.
I hear you.
Whereas when people, like you said, influential people that might be experiencing this, when they speak up, it gives hope.
It gives hope
to those that if this person can't say it,
it gives hope, and it takes away that fear of I'm alone in this.
I'm alone in this. I see. More to come in a moment. Now, you said something when we were chit-chatting before the show started. What are the different levels of depression?
Okay, so like I had said, so you can have the mild, the moderate, and the severe. A trained a trained clinical psychologist and a psychiatrist will elicit different symptoms, and then we can piece them together. The core symptoms of depression affects the mood, like I mentioned before. All right. At this point, let me say something. You know, people think that happiness is a mood. Oh, I'm happy. That means my mood is okay. The normal mood is measured on a scale of 1 to 10. usually a lot of us will cluster on 5. You're neither happy, you're neither sad. When something happens, you move from 4 down to 1. All right. When something positive happens, you can move from 6 like that towards 10. But on the norm, everybody should be in an euthymic mood state. But people think that they have to be happy for them to say that they're okay. No, you're okay in your spirit. You're calm in your spirit. It is when something bad happens that you then shift to be, to 3-2 or 4-3. Okay, so the person who is clinically depressed is more likely to find themselves hovering around 1 and 2, so very low mood state, but they can't explain the reason why they're there.
Amazing.
So, having said that, a depressed mood, low energy. It's like you don't even know why you're weak. Some of them, I can't even work from day to day. I would just feel like I've done so much work. And then interests. Somebody who enjoys doing things, the one who would listen to music, who would dance to just the song that they're hearing. There's a reduction in interest in the things that they found pleasurable. They can no longer surf and enjoy the internet. So many interests become affected. Then we're moving to other symptoms. So we call this now the accessory symptoms of depression. Those are the core areas of depression. Mood, energy, and interest are the core symptoms of depression. We're looking out for them. Once we find mood that is depressed or irritable, I should say that sometimes Africans cannot say that they're sad. It is just anger. Quick to anger. Anger for no reason. So a depressed mother, for instance, can continuously just slash out at her child for no reason. The slaps and the knocks for nothing that the child has done. All right. So now we're moving on to the accessory symptoms. We're looking at appetite, sleep troubles, inability to concentrate and focus at work, forgetfulness.
But isn't that got to do? You are touching on a very delicate area because sometimes age. You forget.
So now you have said age. Forgetfulness in age. We're looking at dementia. Nobody's going to raise an eyebrow. But a young person suddenly forgetting things. We're not going to be looking at dementia because we also know the age where dementia begins to set in. So most times, with the cognitive symptoms of depression, they begin to forget things. They become very clouded. They can't think clearly. They come out of a meeting in the office and they say, I can't remember whatever was said in that. Not even one thing came out with me. Okay, so that
wow.
And then going down the spectrum, you begin to have very more complicated and fearful symptoms like hopelessness, loss of any glimmer of hope. Everything becomes very gloomy. Everything becomes very dreary. And then they begin to see the world as very hostile to them. They feel like they can't get any help. So that's where they talk about hopelessness, worthlessness. Even their self-worth begins to reduce because now they're really struggling. They're in a place where the whole world cannot understand, cannot help them out. And then suicidal thoughts begin to set in.
Wow. Now, can certain illnesses trigger depression? Be it physical illness or whatever.
So particularly chronic medical conditions, like I mentioned before. A lot of people think that when they come to the hospital, they would get like a quick solution to all that is going on with them. If it's not malaria, where you get a course of anti-malaria and then the parasite leaves your system, and if it's not an infection where you also get a course of antibiotics and that infection also leaves your system. For many disorders that you're going to be going to the hospital for, they are chronic. Asthma is chronic, ulcer is chronic, hypertension is chronic, HIV is chronic. So people, the reality of going from having good health, good physical health, to suddenly being given a diagnosis, and the doctor is now saying that, this is not curable, but we can manage it with medications. You would have to keep coming and keeping appointments. That can take a hit on one's psychology. So yes, a recent diagnosis of chronic illnesses, chronic frightening or debilitating illnesses. Another one is seizure disorder. Somebody suddenly gets a diagnosis of cancer, seizure, HIV. It's like you're just hit so hard so suddenly. So such disorders, physical
COVID-19 is not one of them.
COVID-19 it caused a lot of anxiety and depression in people. At least even if it was just reactionary, just related to the diagnosis, it's frightening. Anything that the fear of dying. Even some people who are depressed don't want to die, but then it's always like a looming thing because they just feel like, when am I going to get out of this? And you're like, is this not just staring me in the face?
Yes, because after doing my COVID test, before the result came, I did not eat. I could not even fun. I'm just saying.
I know.
That's on a lighter
Yes,
mood.
yes, I get you.
Just awaiting the results.
Yes. So any frightening thing that you might. So COVID, in a way, you would have had that acute reaction. It could even be acute depressive or acute, a lot of anxiety. But you also know that there's a lot of awareness saying, oh, don't worry, once you're taking this, you're doing this, you don't have to, I mean, you might not die from it. But there's some conditions, some diagnoses that you get, it feels like, oh, am I going to survive this?
Is depression treatable or curable?
So depression is a serious mental disorder, but it is highly treatable. It is very treatable. And the teaching is earlier that you come into coming for help. It's better that the prognosis is better when you come in quickly and you get maybe a course of antidepressant. People would also examine so many things. We're looking at the stressors, we're looking at your trigger factors, we're looking at even your childhood. We use psychological methods, to speak to you, to encourage you so that you can beat depression. And depression is beatable. No one is going to confidently say you have been cured. But by the time you're back to your normal functioning, you're good as being, cured. But we would tell you, you need to be responsible enough to ensure that you're compliant with the medications, seeing your doctor regularly as prescribed.
So as we wrap up the show, you said something about hopelessness.
Yeah.
Give our women some hope concerning depression.
So I think let me give hope more along the lines of everything that is happening right now. I always even say it myself that the concept of hope for some is ambiguous, is vague, but I like to think along the lines of find something that matters to you. Maybe it's your child that you want to say, for this child I am going to excel at being this child, this child's mother. Maybe it's your business. On this matter I'll be a success in this thing. So I wrap it around curiosity. For me, I tell myself, yes, hope is something I can relate to on the lines of, spirituality and so many things. But I always say, I'm curious about what is going to be. I'm curious about tomorrow. I'm curious about if, I do all that I need to do. I work really hard. I play the roles. I'm consistent. I show up. I'm curious of what my tomorrow is going to be. So maybe, I don't know if people can relate to the concept of hope. I can too in a way, but I like to break it down to myself. I like to break it down and say, I'm curious about tomorrow. Let me see what tomorrow is going to bring. Let me see what tomorrow is going to bring.
Okay.
And that's me just saying, hang in there. Be curious. Remain encouraged. Remain reassured that whatever you're going through at the moment, it won't always be like this. Things always change. And
so at the end of the day, there's light at the end of the tunnel.
Yes.
Absolutely. So we want to thank you, Dr. Kafaya Ogunsola, for honoring our invitation.
Thank you, ma'am.
Thank you for sharing some real deep thoughts concerning depression. And I hope our women folk, whoever is living with depression, will have a sense of hope. You're not alone. You are not alone.
And they should get help.
There is help.
Yes.
Do you know the 5 courtesies to apply in your daily routine? It's Etiquette Corner. Time to beam our searchlight on this week's Sisioko.
Akindele Bello Olufunke Ayotunde, popularly known as Funke Akindele. Akindele Jennifer is a Nigerian actress and producer. Funke starred in the sitcom I Need to Know from 1998 to 2002, and in 2009 she won the African Movie Academy Award for Best Actress in a Leading Role. She plays the lead character in the show Jennifer's Diary, for which she was named Best Actress in a Comedy at the 2016 African Magic Viewers' Choice Awards. Akindele came into the limelight after starring in popular United Nations Population Fund sponsored sitcom I Need to Know, which ran from 1998 to 2002. Funke played Bisi, a curious but highly intelligent secondary school student. Funke Akindele's big break came in 2008 when she appeared in the movie Jennifer. She made her directorial debut in 2019 political drama film Your Excellency.
What's trending in the world of fashion? Great pleasure having you join us on The Gallery, A Woman's Perspective. COVID-19 is not a hoax. Continue to keep safe. I am Siju Alabi. Bye for now.